one borderline and one unsatisfactory in the welfare. And unfortunately, the case was a real patient from a real hospital. Okay, so she was very annoyed because the hand was painful, and she was not cooperative at all with her.
Yes, maybe they told us in examination we had to leave the painful site, the last one.
Yes, yes, excellent. Yes, yes. This is what I mean. Okay, so any other questions? Okay, so we for now we will meet our we will listen for the successful candidate stories, and we will discuss with them how they prepared for their cases, so that they will tell us their cases in the previous exam. Dr. Dina, are you with us?
Assalamu alaikum. Yes, Dr. Dua, I'm with you.
Yes. First of all, congratulations for you have like a very successful story, having lots of tears.
Alhamdulillah, alhamdulillah. Thank you. Yeah, and you are part of my success, an important part in my journey. Thank you.
Congratulations, Dr. Dina. The mic with you. Tell us your story from the start.
Yes. Bismillah ar-Rahman ar-Rahim. First of all, I didn't pass from my first trial. I have one failed trial. I had a lot of experience, the most important experience in my basis exam in this failed trial, because I realized what is exactly required. My first case was hypoglycemia in type 1 diabetes. Okay, and this case, I from outside, I thought that it's very easy, so I will do good at this case. But inside, there were a diarrhea. Okay, I mentioned, okay, diabetic gastroparesis. I thought I already realized the case, no issues. No, but they required me to analyze this diarrhea. I didn't analyze the diarrhea. I didn't put celiac as secondary differential, and because the case is very common, they needed from me a perfect differentials. So this was my first shock. Okay, not like studies that superficially. No, Egypt. The main cause of failure in Egypt is differential diagnosis. Okay, yes. And especially in common cases, you need to know them one by one, not I mean, leave any single differential without knowing it. Okay, and also in the case was there was renal affection, so they needed also renal failure. I didn't mention. I mentioned about Addison, autoimmune polyglandular. Anyhow, yani, okay, and when I started to examine the patient, my brain was blank. What to examine? Okay, I will examine neurologically. I asked about blood pressure, sitting and standing. Is this quick? I even didn't examine the abdomen. And when I said to the examiners, they told me, you even didn't examine the abdomen. That in my face. Okay, I will fail you. Yani, that's it. Yani, okay.
Yes.
I went outside. Was very depressed from the case. I didn't do good at all. Okay. The second case was confusion. Secondary seizure, and this case there is no single any specific single differential was required. It's a collection of differentials was required in that case, and the second
there were no specific solution for the case.
Yes, no specific differential. So I realized that Egypt, depending on revising differentials by heart, and this is my what I have focused in my second studying plan strategy. Yes. Okay, I will revise the differentials by heart. Okay, rating them from outside in the 5 minutes preparation. I will write what differentials I will think about from outside, what I will examine in order not to be very confused and blank-minded when I enter them. Okay, so yes. I wrote the positives of any case. This is my strategy. I wrote the differentials of the case. Okay, I focused on that on my studying, and also I wrote what to examine in the case from outside. What to examine. Okay.
You entered with approach.
Yes, and the Dr. Ahmed Mari in Egypt was telling you the patient is complaining from difficulty in walking. So go, let your patient walk. That's it. Let your patient walk in front of you. Watch his gait. Okay.
Yes.
I know someone who failed disease died because there was a back pain, and the case was psoriatic arthropathy. Everyone knows about this case, and she already reached her diagnosis, but they failed her because she didn't examine the back. She didn't have time to examine the back, and the complaint from outside was back pain.
Yes. So this is how to be like intelligent in
Yeah.
yes.
And
Good.
my friend told
Yes.
me about this case. My friend passed this the same exam. Told me in this case I saw this measuring tab. So I realized he needed me to do full back examination like ankylosing. Full back examination.
Yes.
I saw this measuring tab. So what they needed from me, full back examination, and the complaint from outside was back pain. As simple as this, okay?
Yes.
So okay, and in my next exam, okay, this was my preparation, what to examine from outside and what is the differential of the case from outside. I had my first case was uncontrolled asthma, young female patient, and inside she was having this low-grade fever 1 week back, and this is not her first attack, and there is a recurrent attacks in the last 2 years. At the end, the case was bronchiectasis on top of uncontrolled asthma.
Yes.
Second,
Which is uncommon.
Uncommon, and I didn't get a good mark in this case even.
Yes.
Because I bought bronchiectasis, but it wasn't my first differential, unfortunately.
Yes.
The second case was very easy. Weakness from outside, inside, unilateral weakness, and the patient was having uncontrolled hypertension, so it's TIA. So I studied how to examine TIA from my next time of studying. Okay, what to examine TIA. Okay, in order not to think a lot in the exam. Okay,
not to think. Yes.
Yeah.
It is like a play. It is Dr. Dina. It is like a play. You are not a true doctor examining a true case. You are just performing what you have already studied and you have already prepared.
Exactly. Yes. And I almost took full mark in this case. Two communication cases. I need to give you benefits, so I will tell you about all my cases in quick. Communication patient was having serious arrhythmia and was putting a device, but his arrhythmia wasn't well controlled, so he needed some medication, amiodarone. Now he is complaining from side effect fibrosis due to this amiodarone. And the expressions in the communication case, first of all, the communication is very very long, very long. I didn't have time to read it all, and the expressions very not very clear. The patient now is complaining from difficulty in breathing. He is not he let your clinical judgment that this is due to amiodarone. Okay, he is not giving you a very clear words. Okay, and the patient thinks that he wasn't told about the side effects of things. Okay, or he didn't remember. He wasn't told about these side effects, and but he was on regular follow-up in the clinic regarding the markers of the liver and the thyroid. This is the full case. Another case was patient was NAFLD, but the expressions was very unusual. The new name of that NAFLD is steatotic metabolic liver disease, like that, and the patient was very obese, BMI very high, and so talk with him, and he has erratic lifestyle.
Yes, and he needs from you a specific plan in this case.
Specific plan of management. Yes, and
this is the judge.
Exactly. This is the clinical judgment, and this part I lost marks about this mark. They need a specific plan of management.
Okay.
For
so Dr. Dina, during your preparation, you took the clinical course. This is how you start. Tell me how you prepared yourself clinically and the knowledge and the basics of your preparation. How you go through this.
Okay, I was taking course with you. Okay,
yes.
Your course was very beneficial for me. You were giving us the very most common cases, especially in Egypt and other centers, and you were focusing in Egypt because most of us were from Egypt. And you were giving us the difficult scenario of the same case in Egypt, the difficult version of the same cases in Egypt. So this was very important and very beneficial. And after that, I was focusing on studying the differential diagnosis by heart for every and each complaint. And in your course, I will help you, if you don't mind, by giving extra sessions, giving the basics, what differentials in each and every complaint in basis-wise differentials. Okay. This and I was also think on each and every case what to examine, what to start with, what is very
preparing
important
your mind to formulate the examination plan.
Yes, exactly. And you were very perfect in putting the clinical judgment I was writing after you, and the and I was only studying the communication with you. Even I didn't have a very much time for communication. And the clinical course, I took a clinical course.
The clinical course, and also I think you reviewed the ROH. This is added also to your studying.
Yes, ROH is very, very important, and the cases is the main main skeleton of the basis. The cases of ROH. From this ROH, you can know up to 70 to 80% of the cases with different presentation in the exam.
That is the basics.
The main point. So you need to practice it over and over with a professional mentor.
Okay, so Dr. Dina, if you are advising someone to start studying or have like avoid your mistakes and avoid the wasting of time and money, and you need something very formulated, how he could go through this?
Yes, study ROH, okay, revise the differentials, but it's the differentials, it's sometimes ROH is putting some differentials which is not basis wise, and sometimes the differentials are missed. So you can complete the differentials from your course, okay, and I will help you in that, okay? And the clinical judgment and the treatment, the differential diagnosis of the case, you can also study this from your course, and also you can, by the help of the ChatGPT, have very important, very good information, can help you very much. Okay.
What about the clinical? The clinical part, do you advise them to start early in the clinical, and how to like make the clinical skills?
Because for me, it was very important to start early, but I already started early because I have a previous failure trial. So I wasn't, but because I have already studied the clinical part very good in my first trial. I didn't focus actually on studying the clinical, except at the end of at the last months, the last part of the last months. That the very important to make you pass is the long clinical consultation. This is the very important motivation to pass, push to pass. It's examining all the skills, okay, very high marks on it, 28 for each one, okay, and all the skills are tested there. So this is important to focus on. If you have any problem in clinical, please start from now to have clinical course, to know to have an idea about the cases, and to have the written part, or the part needed to be revised early.
So the knowledge under each of the cases for the discussion. Yes. Okay, Dr. Dina, last word for those who are entering the next diet. Last advice.
Do effort, start from now. That's my advice. Start from now, because it's the hard work. 6 months if this your first trial, okay. If this your second trial, okay, you can give it in 3 to 4 months, but also very hard work. Almost daily,
and not to lose hope. Not to lose hope, and
not
be optimistic.
Exactly. Yes. And if because in my last trial, I was telling my lovely friend, Dr. Daya, I will not pass. I will not pass, because I knew that my first case, I didn't practice very good. This bronchiectasis wasn't very easy, and also I knew that I didn't I didn't reply about one concern in
question.
the communication,
Yes.
not very good. And the other communication was there was debate about it. Is it medical error or not? So okay, I told myself, oh, I will not pass. Alhamdulillah, alhamdulillah.
Alhamdulillah, alhamdulillah. But overall, what's good in this exam is that your skill, he is like assessing your skill in all stations. So if you lost some, you will catch them in other stations. So be
Yes.
optimistic, yes, and
Yes.
not to be affected by performing badly in one station. Keep keep high.
Exactly.
Yes.
Yes, if you are very well prepared, you will have the confidence even you didn't do good in one or two or even two stations. Please don't lose hope.
Yes, yes, yes. Make your nerves stable. Thank you, Dr. Dina. Congratulations again. Thank you.
Dina, I had a
Yeah.
question for you. I'm very happy for you, Dr. Dina. You are a very hard worker, and mashallah, you were during your study, your practice, you were very brilliant actually,
Thank
and
you.
you deserve successing from the first time actually.
My Dr. Iman was my supervisor in my thesis. So thank you, Dr. Iman.
We had a long journey together, and I'm very proud of you, Dina. Mashallah, mashallah, I'm very proud of you.
Thank you.
But I just had here a little question that how a case of bronchial asthma, a simple case of bronchial asthma, can have bronchiectasis if he didn't give us clue about a recurrent infection or anything that can, or a chronic
Exactly.
disease.
Yes, the case was a young female was having recurrent chest infection. I started asking, good, okay, since how long? And this is the first time? No, she has recurrent chest problem since 2 years back, and there is no other positives in the case, no other positives, only recurrent chest infections as you mentioned. And after I get out from the exam, I realized that uncontrolled asthma or COPD can lead to bronchiectasis. And
yes, obstructive. Yes.
Yes, this part of knowledge or information I didn't have before I enter the exam, and this can be if I would knowing this kind of information, I would practice much more better in this case.
Yes, Dr. Dina, but at the end of the day, you did the case, the true case. You took the history and you linked what is this asthma with the finding, which is a bronchiectasis. So just tell the examiner, because long-term asthma is a obstructive lung disease, so it can theoretically lead to this.
And that is the point. If you know the information or the knowledge and you didn't practice on it, you will not be perfect in the exam. So not only knowledge, but practice on it with professionals and who have idea about the feedback. And
yes,
I think
even if it is unexpected, okay, don't be shocked and hesitant. Just continue the discussion as a doctor facing a new case. No problem in this, and you will get great marks.
Yes, exactly.
Yes.
And Egypt, there are another cases like confusion, dementia, delirium, secondary seizure. All of these cases, depending on remembering by heart the differentials to arrange them in the exam in order. This is very common cases especially in Egypt. I don't know about other centers.
Okay, Dr. Dina, thank you for your time.
Thanks.
And waiting for your exciting sessions, inshallah.
Inshallah, I will help you. I'm nothing beside you. Thank you.
Inshallah. Okay, Dr. Shaima, are you with us?
Yes, Dr. Dua, how are you doing? Assalamu alaikum.
Yes, alaikum assalam. Dr. Shaima actually bossed the paces earlier. Yes.
Yeah.
I didn't congratulate you before. I didn't give you your certificate. So this is your certificate.
Yeah, thank you very much. Thank you very much. It was my pleasure really to be your first candidate.
Yes.
I think you were the youngest tutor for me, and I was the first candidate for you. But really, you helped me so much. Because of you only, I was able to put it all together. We practiced very nicely before the exam, and it was really very great help from you.
Yes.
Thank you very much, Dr. Dua.
Thank you, Dr.
If you ask me about my experience through PACES, I also passed for the second time. First time it was in Egypt, second time it was in Ajman,